the findings of the AASSA report, I would like to invite Professor Dr. Victor Ho Chiwai Abdullah.
Thank you very much, Mr. Hasman, for the kind introduction. So let me begin by introducing you to the reports. Today, I'm going to share with you the findings from the work carried out by the Association of the Academies of Societies in Asia and the imperative action to promote and protect health in Asia and Oceania. Good afternoon. I'm Professor Dr. Victor Ho from the Department of Social and Preventive Medicine, Faculty of Medicine, University of Malaya, a member of the working group for this report. Just to share with you a little bit background, that this information that I'm going to share with the presentation is based on the findings of the Imperative Climate Action to Promote Health report. This report is the work of the Association of Academy of Society of Sciences in Asia and is part of the IAP project on climate change and health, which is funded by the German government. The report is the work of 15 national academies from 7 regions in Asia and Oceania. From East Asia, we have the academies in China, Japan, and Korea. From West Asia, we have academies in Armenia and Azerbaijan. From South Asia, we have academies from Bangladesh, India, Nepal, and Pakistan. From Southeast Asia, we have academies from Indonesia and Malaysia. From North Asia, we have the Russian Far East. From Middle East Asia, we have Turkey, and from Oceania, we have Australia and the New Zealand academies. The Asia and the Oceania region is the largest regions in the world, stretching from Turkey in the west to Japan in the east, and from Russia Federation in the north to the New Zealand in the southern hemisphere. It's the most diverse climate variation from desert to lush forest. From the highest mountain in the world to the lowest depth of the ocean. It's also one of the most vulnerable regions to the effect of climate change. This is because the region has the highest population, 4.6 billion, which accounts for 60% of the world's population. It has countries with the highest population density, from 9 people per square meter in Russia to 1,265 people per square meter in Bangladesh. Has some of the longest stretches of coastal area, which is prone to flooding and rising sea levels. The region's urbanization ranged from 21% in Nepal to 92% in Japan of its people living in cities. Topping it up, many of the countries in the region is still largely dependent on agriculture-based economies. The region is also disaster prone from extreme weather events, and due to the large number of people and a high population density, a large number of people have been affected by natural disaster over the last decades. Since 2000, more than 1.2 billion people in the region have been exposed to hydro-meteorological hazards. There were more than 1,200 disaster events happening during this period, which accounts for the global human exposure of 91% of tropical cyclones, 92% of floods, and 66% of landslide on per head basis. From 1970 to 2011, more than 2 million people have been killed because of natural disaster, which accounts for 75% of the global fatalities. The risk of people exposed to flooding in the living cyclone prone are doubled from 1970 to 2010. More than 60 million people are exposed to flooding risk, and more than 120 million people are residing in cyclone-prone areas. In the following few slides, we will describe the model on how greenhouse gases may lead to adverse radioactive forces that leads to global warming. Global warming will lead to environmental impact and lead to environmental modification, which later leads to environment impact. It's causing multiple environmental events, from increased sea levels, causing both increase and decrease in precipitation and leads to extreme weather. The modification of the environment will cause negative environmental impact, which leads to negative health impacts. The model is an example of how greenhouse gases may affect human health. The major health effect of climate change includes vector-borne diseases, infectious diseases, flood and infectious diseases, malnutrition, particularly undernutrition and stunting, air pollution and cardiovascular, fire, long-term impact of human infertility and forced migration. Mental health issue has been observed in different extent among countries in this region. There's also a problem of direct and indirect related effect. Direct health effect of health includes heat illnesses, exacerbation of pre-existing health condition, and increased hospitalization. The direct effect of heat includes heat rash, heat cramps, heat syncope, heat exhaustion, heat stroke, and ultimately death. Heat can also exacerbate pre-existing respiratory and cardiac condition. The effect of heat does not only depend on absolute temperature, but also on the relative changes in temperature. In New Zealand, condition where temperature is above 25 degrees is considered hazardous and lead to increased heat-related morbidity and mortality. It can also cause indirect health effect on pre-existing medical conditions such as cardiovascular disease, respiratory condition, mental health, and diabetes. People with pre-existing medical condition may be more prone to develop heat exhaustion and heat stroke. With more and more people moving from the rural areas to live in cities, urban heat island will become a problem in the future. For example, in Australia, 90% of its population that is living in urban areas will be affected by heat. The heat vulnerable index for Australia is also in a high and upward trend. An increase of 1.5 to 2 degrees C will lead to more than 27,000 heat-related deaths, and annually of it, 822 million urban inhabitants in China. Heat also can cause indirect health effect, which increase ambulances calls out for slower response time due to heat stress, increase in hospital admission, increase in accidents, for example, drowning, work-related accidents, injuries and poisoning, increase in transmission of food and waterborne diseases, and bloom in marine algae, potential destruction of power, water, transport, and decrease in productivity. Heat not only affect the population, but also heat also affect outdoor workers like agriculture, forestry, and fishery, leading to heat stroke and decreased productivity. Besides heat, cold events can occur due to effect of climate change and pollution. Smog formation from human activities was attributed to the increase in cold weathers in Nepal, with 58 locations affected in 2010. Bangladesh also have seen severe cold events in the past 2 decades. And in China, cold-related mortalities outnumber the heat-related mortalities by 20 times. Forest and bushfire can lead to forest and bushfire can occur naturally due to prolonged dry days and reduced precipitation and high temperature. It can also occur due to human activities of biomass burning for agriculture activities. It is a recurring issue in many countries in the region, including Australia, Armenia, Azerbaijan, Indonesia, India, China, Malaysia, New Zealand, Singapore, and Turkey. Fine particles from fires is also hazardous to health and can travel very far, even across seas. The fine particles from fire in Australia has been found across the Tasman Sea to New Zealand. Similarly, fires in Sumatra and Indonesia has crossed the Strait of Malacca to Singapore and Malaysia. There has been increasing forest fire and more people affected by fires. Here are some of the examples from China, India, Turkey, and the Russian Federation. Forest and bushfire releases sulfur dioxide, nitrogen oxide, ozone, carbon monoxide, and total suspended solids in the form of particulate matters, PM10 and PM2.5. It can affect cardiovascular, respiratory, and psychological health for susceptible individuals. Climate change and flooding. Flooding is a major issue in countries in this region. Global warming leads to excessive precipitation and increased sea level. Excessive melting of Himalayan glacier leads to flooding in Nepal, India, and Pakistan, and Bangladesh and Bhutan. The Ganga originates from the lake of Manasaoa in the Himalayas. More than 400 million people live in this river basin. In China, half of the people and 2/3 of the land falls under the heavy threats to floods. In the last 30 years, the frequency and severity of extreme floods have increased. In New Zealand, Armenia, and Russia also see the similar issues of flooding due to climate change. Flooding leads to human health issue. In China, infectious diarrhea diseases increased by 4.8% during flood years. Flood in Solomon in the 2014 led to nationwide outbreak of diarrhea diseases caused by rotavirus. Outbreaks of diarrhea diseases from cholera, rotavirus, and leptospirosis following floods in India and Bangladesh. Floods due to cyclone also caused displacement, leading to sanitary and hygiene issues. In Australia, flood led to increase in dengue and leptospirosis. In New Zealand, flooding in 2017 and 2015 led to the dispersion of toxic chemicals, dam houses, and mental health issues. In China, acute CVD death among women in flood years were higher than in non-flood years. These are some of the health issues that related to flood. Now we come to the infectious disease, the threat and climate change. The threat of change in the temperature and precipitation increase and decrease of precipitation and humidity leads to the profound impact on life cycles and growth of infectious agents and their vectors. It can lead to impact on access to clean water, increase in polluted water, can also increase the threats of infectious disease due to the lack of safe water. The diagram summarizes the effect of changes in climate, extreme weather events, and the indirect effect of some of the pathway for infectious disease threat. Changes in the baseline climate can lead to cycles of vectors and pathogen, expansion of geographical distribution disease. Changes in extreme event can lead to cycle of vectors and pathogen as exposure of geographical distribution, which indirectly leads to population displacement, poor nutrition, and damage to health care infrastructure. Infectious disease can cause by waterborne diseases, foodborne diseases, and also vector-borne diseases. Food and vector-borne, here are some issues faced by countries in this region. Pakistan has the highest incidence of typhoid fever in South Asia. In Nepal, the outbreak of food and waterborne diseases is becoming more common. The risk will increase with the increase in the temperature and the rainfall. In India, the issue is in the lack of access to clean water, which is further worsened by the depletion of groundwater due to drought. The changes in the temperature has led to the change in the exposure to pathogen microorganisms as shown in Korea and Japan. Next, we come to vector-borne diseases. Some of the vector includes mosquito, ticks, sandflies, and fleas. The changes in temperature has led to the emerging and re-emerging of vector-borne diseases in areas and countries where previously it was not an issue. In many of the temperate countries, the Aedes mosquito are now present in their environment. Climate change will lead to higher risk of food insecurity and malnutrition. Studies have shown that the elevation of carbon dioxide levels can impact on nutrient concentration in food, which can lower iron, zinc, and protein levels in plant-based food. Many of the countries in this region still depend mainly on plant-based food as their staple diet. Rising sea levels, rising sea surface temperature also correlates with the microorganism and biotoxin levels in seafood. It also increases the rate of methyl mercury formation. In countries where seafood is consumed widely, like Japan and New Zealand, this will become an issue, especially during the hot summer months. Malnutrition anemia is a major health threat to both developing and developing countries. In developing countries, chronic malnutrition can lead to stunting, wasting, and underweight. Stunting is a problem in South Asia, particularly in Nepal, India, and Pakistan. The diagram shows some of the effect of global warming on agriculture. It can lead to loss of fertile coastal land caused by rising sea levels, loss of biodiversity, increase in adverse weather event leading to more unpredictable farming conditions, and increased incidence of pest and vector-borne diseases affecting plants and livestock. Effect of air, water, and soil pollution with environmental toxicants directly from human activities or indirectly for effect of climate change can also lead to adverse health effect. In a study in Malaysia, researchers have found that climate change influences the female fertility. The diagram explains the multiple routes for changes in the female fertility from air pollution, El Nino, temperature, heavy rainfall, sea level, food, altered hormone, and also allergy and other factors which can lead to climate change in female fertility. Now we look at the adaptation and mitigation option. Previously, we have just shown that what is the climate change and health effect. Moving on to the adaptation and mitigation option. The Asia and Oceania region needs an integrated mitigation adaptation strategy tailored to its own needs to combat the effect of climate change on human health, society, and environment after implementation of international agreement. Developing countries, especially those in South Asia, are facing difficulties in implementing mitigation and adaptation plans for several reasons compared with developing countries. Several case studies are presented to show the implementation of the plan in various countries. National Adaptation Plan for Climate Change and Health. The idea is to accumulate scientific data and knowledge on climate change to fill the evidence gap, to increase evidence-based research and studies of capacity related to climate change and health, to identify the most pressing health threats from climate change, to provide scientific information, meteorological and medical and geographical warnings and alerts for prevention and adaptation by cooperating with relevant ministries and agencies, to raise awareness among general public, policymakers and healthcare providers, in addition to promoting effect by companies and local governments, to provide structural surveillance, monitoring and reporting system, to strengthen the capacity of healthcare system, including health preparedness and response to cope with the health effect of climate change, and to reinforce the health preparedness and response at the national, state, and district level. We provide an overview of adaptation and mitigation initiative to climate change with human activities. The mitigation include reducing greenhouse gas emission, enhancing greenhouse gas sinks, long-term focus on avoiding future impact, global scale cross-sectoral effect needs to be effective, local and subnational nesting and collaborative needed. We also need to reduce vulnerability of enhancing adaptive capacity, start with focus on current variability, large-scale cross-sectorial effect needs to be effective, and sub-national global collaboration needed. These are the overview of the adaptation or mitigation for climate change with human health. General point for effective adaptation mitigation: the importance of communication across different sectors, to develop and pilot early warning system for heat wave and health risk factors, research and studies on prevention and control of climate change and related diseases, enhance of health and care system, social transformation to help promote awareness and control and to improve water quality, sanitation and hygiene levels, development of technologies for adaptation and optimization of agriculture sector. There are co-benefits of mitigation from transport changes, electric cars, active transportation, and public transportation, from house and energy consumption, reduces greenhouse gas emission and reduce pollution. Encourage healthy lifestyle. Active transportation reduces both greenhouse gas and improve health. Improve housing, reduces heating and cooling costs, and also reduces greenhouse gas emission. Dietary and food system, changes dietary to more plant-based, reduces greenhouse gases. Agriculture and forestry benefit, and also technological transfer from developed to developing countries. There are a few case studies presented in the report. One of them is Klang Valley mass transit system and also prevention of intrusion of the Caspian Sea, which I'm not going to describe due to the limitation of time. We're going to continue with co-benefit from action of agriculture and food system, exploring roles of community forests, reduce ethanol production and fuel substitution, and climate smart village in Havana. Common challenges in Asia and Oceania. Finally, we are going to, then after that, we're going to discuss about the conclusion and also recommendation. Common challenges include low public awareness, insufficient research, inadequate data and limited access to data, limited healthcare facilities and resources, insufficient financial economic support, impact of high financial and disease burden, especially on the poor. Conclusion. Climate change is happening on a wide regional scale and escalating. Climate change effect on health through multiple pathways. Identify regional variation and impact solution and science-based evidence and avenues for regional cooperation for mitigation is necessary. Identify new research area, increase in transdisciplinary intersectoral information sharing on the outlook of public health issues associated with climate change should be encouraged. Accumulate and use of evidence on health impact of climate change for reports emphasize that basis of coherent health policy development for climate change mitigation and adaptation strategies, increase the responsiveness of health impact on climate change, as well as in promoting action that improve health while reducing greenhouse gas emission, clarity of public health issues associated with climate change that should be addressed through multilateral collaboration, and highlight the common needs for national planning. Dealing with new and emerging health issues in Asia and Oceania in the face of climate change and a common solution. One size fits all may not solve complex problems faced by people in different social, economic, and political systems. Recommendation is to improve education and training, to increase research and knowledge and implementation, to integrate healthcare facilities, services, and implementation, to improve government support in policy development, and to improve financial aid and adequate resources to ensure that the future of humankind is safe from climate change that's currently happening. Thank you very much.